Hi, it's May 31st. Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update. Beautiful day in Oklahoma City. A little warm, but just beautiful now. Uh, so, statistics on COVID, about 370,000 deaths in the world, almost 6 million cases in the United States, almost 1.8 million infections with about 106,000 deaths. Oklahoma, we're pretty steady. Um, and we have about 344 deaths. Uh, the biggest thing kind of going on with COVID right now is there's new data. I think data is important, as I'm going to tell everyone over and over, and I think there's some really positive data coming out. The first positive data, well, it's anecdotal, but it comes from several physicians in northern Italy, that they're seeing a change in the intensity of the illness in the COVID patients they're now seeing, and it's noticeably different than it was 2 months ago when you're looking at same age, same pre-morbid conditions. And this one of the doctors in Milan, who's been kind of the lead person for this, really feels like there's a potential viral change with COVID. So of course I'll be following that very closely. There's going to be obviously a lot more genomic data coming out, but they've noticed less viral intensity and lower viral numbers on some of the cultures. So that's very exciting if the virus is actually changing in a way that makes it weaker. That would be extremely positive news for all of us across the United States and the rest of the world. And so that is big news, and we don't know for sure yet, but that is very positive. There's obviously a police car or fire truck coming by, or ambulance, so just ignore that. Number two, the Yale information from their epidemiology department showed that Plaquenil is highly effective for outpatient use and early use. That's very exciting news. Number three, again, I think this kid data that I've been talking about is really important, that a lot of these kids in China and now keeping in mind not very many got sick, but the ones who did get sick, 50% of them had concomitant other infections. And so now we're having a jet. It's been quiet all day, but not now. Sorry. But again, the fact that these children who have gotten sick, at least half of them have mycoplasma or walking pneumonia, mononucleosis, and all these other environmental pathogens that cause serious respiratory disease. Makes you wonder a lot about what's going on just in general with adults. And if we look at that a little more carefully as we see people, maybe we're going to learn a little bit more stuff. And then there's the drama of the media. I saw the BBC had a little article about sick. Why are these sick 18-year-olds happening? Well, they had one 18-year-old they were talking about, and this doctor was, why is this happening? Well, her whole family got COVID from going to a funeral. She got sick. They put her on oxygen and a CPAP machine. That to me is not getting critical. That's not getting sick, really sick. I mean, yes, she got sick. She had to be hospitalized for 4 or 5 days, but that's just getting ill and getting ill enough to be in the hospital. But she got some supplemental oxygen and CPAP. Now, she did get randomized to a clinical trial, but we don't know what she received. But she was in and out in the hospital in 5 days. So, I mean, that is not my definition of a really sick person. But again, people are going to get the virus who are kids. And again, and when I'm saying that it's not hitting groups, what I'm meaning to say is they're not getting particularly ill. So like pregnant women. Yes, pregnant women have gotten COVID, but there's no significant reports at all of them getting sick with COVID. And again, the child data and the autoimmune patient data and the cancer patient data is all incredibly reassuring that this virus isn't selecting out against them. So again, we just have to always think big picture as I'm talking, and if you want to analyze it exactly, go ahead and then send a note on the post, and I'll try to answer it when I get to it. But I do have a real job, so sometimes I don't get to it as often as I would like. Then again, the protesting that's going on, and just again, the whole thing's tragic on every level. But the big thing is we have to see in some of these cities if the protests and all those people being close together, but thankfully they're outside, um, if that's going to cause a little pulsation of illness, we won't know for several weeks. We can keep our fingers crossed. If it's warmer, they're outside, perhaps it won't be all that significant. So that's really the COVID update today. I think things are very stable. It's not booming in the United States right now. There's going to be a lot more data coming out for effective treatment. I do think the data is pointing towards schools reopening safely. Colleges should be able to reopen safely if people will just be rational and look at the data. I don't think there's any reason why a college can't open, why schools can't open. Teachers are going to be okay. Again, you need to take your vitamins. People are going to still get sick from COVID here and there, just like they're going to get sick from influenza and they're going to get sick from other things. But we know now the groups we have to focus on, which is older people, people with heart disease, people with hypertension, and things like that. No, I'm getting attacked by a bee now. So anyway, it's been a heck of a time, so I'll just end on that note. Sorry, but again, if you're in a group that's high risk, we're going to have different parameters for you. But we have to base society on the majority. And so if you're a higher risk person, there's things you can do, which we'll go over. So anyway, good night. Sorry we had the assaults of the plane, the ambulance, and the bee. So thank you.